Hi, good evening. Today we'll be discussing a very important. I'm Eze Araroyeka. Today we'll be discussing a very important non-communicable disease known as diabetes mellitus. Diabetes mellitus is a chronic disease that the prevalence and the incidence has been on the rise in our dear country, Nigeria. So today we'll be looking at diabetes mellitus, which is a disease that is often referred to as a metabolic what disorder. Hormones, hormones are typically regulated in a feedback loop where the production of a hormone is linked to its effects or circulating concentration. However, there are certain conditions where this regulation does not apply. For example, in the case of diabetes, this particular regulation is not really working proper because it's expected that the presence of a particular hormone will actually inhibit the secretion of another hormone. But in the case of diabetes, it doesn't really work. In diabetic condition, the cells are deprived of glucose because the glucose is unable to enter the cell, even in the abundance of this glucose. You know that glucose is the end product of carbohydrate metabolism and other food substances, which is necessary for body metabolism, ATP, and all of that. But in the case of diabetes, the patient is eating, but the body is unable to make use of the glucose, even in the presence of a lot of glucose. So that's what happens in diabetes. Check this scenario, like you have food. Somebody got your food, but you don't have hands to feed yourself. That's how we can explain diabetic condition to be like. Because in the body, the presence of glucose, you have just eaten, and the digestive system have digested the food, but the glucose is unavailable for the cell, even in the presence, because the cell cannot actually recognize glucose or make use of glucose without the help of that hormone, insulin. It is the insulin that will carry this glucose into the cell, and the cell will now use it for normal functions of the body. Take it also to be like you have a very big water and you have a baby. Ordinarily, if you allow the baby to pass through the water, baby cannot. But you now back this baby to cross the water. So that's like what the insulin backs the glucose and carries it into the cell. So here, the person body has lots of glucose, but cannot make use of the glucose, even in the presence of enormous glucose. Type 1 diabetes represents 10% of all cases of diabetes and mostly occurs among people who are under 20. Whereas type 2 diabetes occurs among people between the age of 40 and 60 and accounts for over 90% of all diabetic cases. Now let's look at a very interesting thing, because we need to identify the organ that is responsible for this condition known as the pancreas. This is the liver. This is the liver, and this is the gallbladder. This is the large intestine. So now we're looking out for that particular gland that's responsible for diabetes, and that is known as the pancreas. Look at the pancreas. This is the gallbladder. This is the liver, trying to point to the liver. This is the duodenum. This is the duodenum. Look at the pancreas. This is the liver. Still pointing at the liver. Look at the pancreas here. Look at the pancreas. Look at the pancreas here. This is the pancreas that is responsible for this condition known as diabetes, when it begins to fail or is not able to produce enough insulin. So that is the pancreas. And this is the large intestine, the stomach. This is the stomach. Now, look at a more broader view of the gland. This is the pancreas, and this is the gallbladder, and this is the stomach. Then this is the first section of the enterics or the intestines. But this particular organ or gland, known as the pancreas, has several, it has alpha cells, beta cells, and delta cells. These cells produce significant or different types of hormones that are necessary for digestive processes, like the pancreatic juice. It processes the pancreatic juice necessary for digestion of different food substance. And this is the first section of the duodenum. However, this pancreas also produces the insulin necessary for transporting of glucose. Look at the organ very well. Necessary for transportation of glucose into the cells. And this is the gallbladder. Look at the dots where it connects with the pancreas. So look at the pancreas, and the other shadow is the stomach. So this organ is the organ responsible for this condition. Diabetes mellitus is characterized by hyperglycemia and glycosuria. The most common type occurs in childhood and is type 1 diabetes, which is caused by autoimmune destruction of the insulin-producing beta cells, known as the islets of the pancreas, which causes permanent insufficiency or deficiency in insulin production. That is the cause of type 1 diabetes, which is just 20%. It's a result from destruction of the insulin-producing beta cells, known as islets of the pancreas. It's more of autoimmune destruction, like where the body begins to fight itself. So that's what leads to type 1 diabetes. Like we were discussing, look at the liver, look at the liver, gallbladder, look at the pancreas, situation of the pancreas, look at the stomach here. This is the stomach. This is the large intestine. And this is the duodenum. This is the duodenum. Type 2 diabetes. Type 2 diabetes results from insulin resistance by cells and relative insulin deficiency. So in this condition, it is of two. In type 2 diabetes, it results from the body not able to produce enough insulin, and also even the one that is being produced, the cells are unable to actually identify it uh, as insulin necessary for transporting of glucose into the cells. So, however, the less common types of diabetes result from genetic defects of the insulin receptor, or most times inherited abnormality in sensing of ambient glucose concentration by pancreatic beta cells. So, and the major at risk for this, the major at risk or risk factor of type 2 diabetes is being obese. Okay, so type 2 diabetes can result from genetic defects of the body to sense the presence of insulin. It can also result from insufficiency in production of insulin. Classification of diabetes mellitus. We have type 1, which is also known as insulin dependent. This particular condition manifests immediately after birth and can last 1 to 3 months. And the major cause is due to pancreatic defects and is caused by glucokinase deficiency, which is an inborn error of the glucose insulin signal pathway in the body. Then under it, of course, have the classic type 1, which is also has the symptoms like glycosuria, ketonuria, that passing of ketone in the urine, passing of glucose in the urine, excessive sugar in the blood, also known as hyperglycemia, and islet cells positive and genetic component are also part of this classic type 1. Then another classification of diabetes is type 2, also known as non-insulin dependent. You know, when we were discussing, we said that one is dependent on insulin. Is a problem that resulted that the pancreas is unable to produce insulin because of being destroyed by the body. That one is known as insulin dependent. But in the other type 2, the body is producing insulin either very little or in a large quantity, but the large quantity is unable to be sensed by the body of the person. So that is why we call it non-insulin dependent diabetes. And it mainly has the risk factors such as obesity, insulin resistance, and also has genetic components. Also, other types of diabetes are gestational diabetes, which is abnormal glucose tolerance during pregnancy. So women, or most women do have this condition, but however, after they put to bed, this condition tends to disappear. Like we explained earlier, insulin deficiency or insulin dependent diabetes mellitus is a condition that occurs due to the autoimmune destruction of insulin producing beta cells in the pancreas. And the major hallmark of diabetes mellitus 1 is the presence of diabetes susceptible genes in the patient, along with unknown environmental triggers that initiate the autoimmune process. Some examples of these triggers include early exposure to cow milk. Some research has shown viral infections such as the Coxsackie virus, cytomegalovirus, the mumps virus, and the Ebola virus. Then vitamin D deficiency and perinatal factors like prematurity. These can be the triggers to type 1 diabetes that occur among people less than 20 years of age, and that account for just less than 10% of all diabetes cases. Diabetes type 1 is primarily considered a T cell mediated disease, meaning that T cells play a significant role in the development and progression of this condition. For knowledge sake, the major thing you must know about diabetes mellitus is that it presents in the patient or client with polydipsia, known as excessive thirst. The person will be drinking a lot of water because the person is passing a lot of water due to osmotic diuresis. Polyphagia, increased hunger. The person will be eating, yet the person is feeling hunger because the glucose that is in the blood, the cell cannot make use of it. And the cells will now be sending signal to the person that, you've not eaten, go and eat, we are hungry. Then polyuria, which is known as frequent urination. This frequent urination results from passing that urine due to osmotic diuresis, because sugar is in the blood and is drawing water out from the blood. So you keep on passing urine. In diabetes, the body cells switch to utilizing fatty acids and ketones as the primary source of ATP. And you know that ATP is the energy required by the body for functions, because glucose is not really available. Even though the person is eating, the glucose is in the blood, but the body cannot use it. So the body will now switch to utilizing ketones and fatty acids, which are already stored in the liver. And you know, ketones and fatty acids are acidic in nature, whereas the body operates in a neutral environment. So as it continues to utilize ketones and fatty acids to produce a glucose for the body to function while waiting for glucose to enter, the body will now move from being neutral to acidic, and that leads to acidotic state. The person might go to coma. Hyperglycemia occurs when the production of insulin becomes inadequate to enhance glucose uptake by the cells. Secondly, the suppression of the liver and the renal glucose production from proteins such as, also known as glyconeogenesis. And thirdly, prevent the breakdown of glucose, also known as glycogenolysis, in the liver and muscle cells. When the body continues to produce insulin, the liver's conversion of stored glucose is suppressed because insulin secretion acts as inhibitor. So what we're trying to explore, we're trying to explain the pathophysiology of what happens when someone has diabetes. Ordinarily, the body is not supposed to have hyperglycemia. But because in this condition, there is no or little insulin, the liver and the kidney will continue to convert glucose to glycogen, to glucose. So within 24 hours, the liver and the muscle stores become depleted and the body switches to other sources of energy, such as ketones, since glucose is not entering the cell. So what we're trying to explain here is that on a normal, if the body is functioning optimally, hyperglycemia would never occur. But because insulin is not being produced, there will now be hyperglycemia. In a normal human being, or in a person that is not having this disorder, when the person consumes glucose-based food and the digestive system digests these substances to the final product known as glucose, immediately the insulin will take this sugar from the blood into the cells. As such, prevent glucose from spilling over in the blood or being for a long period in the bloodstream. But however, because the insulin that is supposed to be transporting this sugar into the cells is not there, the cell will continue to send signals to the body that I am still hungry, I have not eaten. As such, the organs such as the liver and muscle cells will begin to convert the glucose that is already stored in form of glycogen, because the storage form of glucose is known as glycogen, which is stored in the muscles and in the liver. So now, because the cells are saying, I have not eaten, no, we've not eaten, now send a signal, and the already stored ones in the muscle will begin to be converted from glycogen to glucose. And the ones in the muscles will now be converted from glycogen to glucose, increasing the amount of already glucose in the blood, and that will lead to hyperglycemia. But remember that if at all the insulin is being secreted in the bloodstream and is being sensitive or have sensitivity to the receptor that is meant for it, the presence will suppress the conversion of this glycogen into glucose. So that's why we say that hyperglycemia occurs when the production of insulin becomes inadequate to enhance glucose uptake by the cell. Secondly, the presence of insulin suppresses liver and renal glucose production from protein known as glyconeogenesis. And thirdly, the conversion of already stored glucose in the liver and muscle into a process known as glycogenolysis, trying to convert already stored one, and the production of a new glucose by the kidney. The presence of enough insulin in the blood prevents this from happening. But because the body says there's no, or the insulin is not being produced enough, which is a signal, these organs will now be producing new glucose and converting the already stored one. As such, there will be increase in blood sugar, known as hyperglycemia. So within 24 hours, the liver and the muscle stores become depleted. And when this happens, the body switches to other source of energy known as ketone. And this process is known as ketogenesis, since glucose is not entering the cells. Look at the red blood cells and look at that particular organ. Ketogenesis is a sign of more complex insulin deficiency. The lack of suppression of gluconeogenesis and glycogenolysis further worsens hyperglycemia, while fatty acid oxidation generates ketone bodies, known as acetone, acetone, and acetone. Excessive ketone production predisposes the body to acidosis and osmotic diuresis, also known as urination, which occurs as a result of the diabetic state, which leads to excessive loss of fluid from the body. Because there is excess glucose in the blood, the body will try to remove excess glucose through urine, and this leads to the person keep on urinating. And as this continues to happen, there are more sugar and water is going away because the body wants to maintain homeostasis. It's removing a lot of water in order to remove the sugar that's excessive in the blood. But that does not really happen. As that water that's supposed to dilute the sugar in the body, the water is going away. The body becomes more concentrated and more acidic, and that leads to acidotic states. Insulin deficiency typically first causes postprandial hyperglycemia, that is high blood sugar after meal. That's how you first notice it. After meal, the sugar in the blood rises. Then it proceeds to fasting hyperglycemia, that is high blood sugar, even when someone is still fasting because the sugars are not going away. Glycosuria, also known as glucose in urine, occurs when the serum glucose concentration exceeds the renal threshold for glucose reabsorption at the proximal tubules. Glycosuria leads to an osmotic diuresis, including the obligatory loss of sodium, potassium, and other electrolytes, resulting in dehydration and subsequent polydipsia, excessive thirst. So as the person keeps on urinating, the person will be losing a lot of potassium, sodium, and other electrolytes, and the body will now be sensing the person to drink a lot of water, because the person is losing water. Polyphagia, also known as persistent hunger and weight loss, results from persistent catabolic state and the loss of calories through glycosuria and ketonuria. So as the person keeps on eating, the body is sensing it to continue to eat, but the person is losing most glucose through urination because the urine is still in the blood without being used by the body. So the classic symptom of diabetes type 1 is polyuria, known as excessive urination, polydipsia, known as excessive taste for water, then polyphagia, excessive hunger, and weight loss. Diagnosis of diabetes. A diabetes diagnosis is made based on 4 glucose abnormalities that may need to be confirmed by repeated testing. Take note, you have to do a repeated testing before you can conclude. One is a random blood test. When the plasma glucose is greater or equal to 200 milligram per dl with symptoms of hyperglycemia, or 11.1 mole per liter on 2 occasions, we can diagnose diabetes. Then, fasting blood sugar level, when glucose concentration exceeds 126 milligram per dl or greater or equal to 7 mole per liter on 2 occasions or once. Another diagnosis is a random blood sugar. That is, you call this patient and just do this test use the blood to assess the presence of sugar or the sugar level. When it is greater or equal to 200 milligram per dl with symptoms of hyperglycemia or 11.1 mole per liter on 2 occasions, we can diagnose diabetes. Or if the person is having an abnormal oral glucose tolerance test with a 2 hours postprandial serum glucose concentration greater than 200 milligram per dl or 11.1 mole per liter or 75 grams of sugar. So these 2 hours postprandial is the person have eaten after 2 hours, you do the test and it is up to 200 milligram per dl or 11.1 mole per liter. So these are the normal range for glucose in the blood. Fasting serum glucose should be 6.0 mole, then which is known as normal glucose. 2 hours postprandial should be 7.8. When it gets to 11.1, it is now diabetes. And when it gets to 7.0 for fasting, in fasting, if it gets to 7.0, it is diabetes. But when it's less than 6.0 in fasting, then it is normal. But in 2 hours serum glucose, if it is greater than 7.8 up to 11, when it's less than 7.8, it's normal. But when it is greater than 11.1, it is diabetes. The 3 key tasks as community workers is 1, achieve strict glucose control. That's the major thing in control of diabetes. You have to educate this patient on how to achieve strict glycemic control. Then achieve a blood pressure less than 130 over 80 millimeter mercury. Then you also have to help the patient to achieve control of blood lipid level, both type 1 and type 2, the blood lipid level should be normal. Then you have to educate patients, reassure this patient, and support them. Also tell them about exercise, which is very important. Then when the patient begins to complain of sight-related issues, you refer to ophthalmologist. Principles of dietary management of diabetes. Keep to a regular, nutritious diet. Achieve ideal body weight. Reduce calories, including added sugar, dietary fat. Increase proportion of vegetable consumption, fresh fruits and cereal fruits. Follow a low carbohydrates and healthy fat diet. Blood glucose testing should be routinely monitored before each meal and at bedtime. Another type of diabetes we will look at is non-insulin dependent diabetes, known as type 2 diabetes. How does this occur? Diabetes type 2 can occur as a result of various pathophysiologic processes. However, the most common form results from peripheral insulin resistance and compensatory hyperinsulinemia, followed by failure of the pancreas to maintain adequate insulin secretion. We've talked about this in our earlier slides. Management of type 2. First line management. If the person is obese, you have to make sure the person reduces the weight, ensure that the blood lipid level is maintained, control the blood pressure, eat healthy diets. Then the person can be placed on diet therapy. The person should engage on 20 to 30 minutes exercise per day or 450 minutes a week. Most symptoms improve dramatically within 1 to 4 weeks on diet and exercise alone. If unsatisfactory control persists after 3 to 6 months, consider adding one of the oral hypoglycemic agents, usually starting with metformin. It's a guideline, but however, follow your national standing orders directives. Controls. Primary goal is to keep it under what? Control. All diabetes, the idea is to keep it under control. Then regular physical exercise helps you to feel better. It also improves your sensitivity to insulin. Then eat a well-balanced diet, which reduces stress. Quit smoking. These are important. Thank you very much.